have really bad vertigo, and it kind of puts your life on hold. I've had to leave work. I know that I'm letting people down, and I don't like that feeling.
I went to 3 different doctors, and they said that, just take the medicine, So that's, I would take it if it was really bad, but it would get, I have headaches about at least 6 days a week, so.
You get up and you take Advil or whatever, and you just go through life, and you do that every day, and you think that's what you're supposed to do. And it's not now.
Went to my primary care physician. I went through biofeedback sessions. From biofeedback sessions, I got my eyes checked, had a CAT scan to make sure that I didn't have any tumors going on, and then basically just kind of blew it off.
Been to neurologists, been to several different doctors, and they just kind of make you feel like it's in your head.
Ended up in the hospital doing CAT scans, had 2 CAT scans done, and ended up, they said they really couldn't find anything wrong. They put me on medicine and said I could do that, and I'm not a medicine taker, so I just continued to live with it.
When you go to the doctor so many times and they make you feel like you're crazy, you guys, you knew what you were giving me hope, something to finally help me.
And my range of motion and my opening was dramatically increased, and I woke up this morning without a headache. So I'm very, very excited about it. It was the first in a long, long time. I could cry about it right now.
It's been a hard road, and this is a light at the end of the tunnel, so I'm excited about it.
I feel completely released and no pain whatsoever, and that's amazing.
There's no amount of money that I would pay to have this done to make me feel better.
When they see their discrepancies in their bite, everything makes sense to them. It's easy.
As a matter of fact, when I talk with dentists who've done this program for 4 years, they've said 95% success, and that may be underestimating it.
She had migraines, body aches, couldn't sleep, numbness on the side of her head and face, tinnitus. She looks 15 years younger. She thinks I walk on water. And it's amazing to see how her life has changed, and she tells everybody.
There are patients everywhere that need your help. There are patients, there are family members, there are staff members. Probably 80% of your patients that you have of record.
I love having patients come back and tell me that they don't have any headaches and migraines, or their jaw doesn't hurt, jaw doesn't pop and click anymore. I am so happy that I can provide that service to them.
Within 1 or 2 appointments, they're totally better. I'm the only one that can do that. There's no one else that can do it. I don't care how many letters you have after your name. I'm the guy that can fix it. Every time they come to see me, we're the superstar. They say, thank you for giving my daughter back to me. It's just the best thing that I've ever done. We have doctors, we have neurologists, we have people from Yale New Haven Hospital emergency room sending us patients. And we get referrals from other dentists as well. We get referrals from oral surgeons. Our increase in production was pretty substantial. Once we got going, we pretty much paid the program off in the first couple months. From there, we went from just paying the program off to probably doing $30,000, $40,000, $50,000 a month. And that was pretty easy to do. And the thing that's wonderful is everybody gets better. So it's not all about the money, but you'll feel good all the way to the bank. One of the things that I really like about this program is not all dentists are involved. We're almost like an exclusive group of people who have really taken occlusion to the next level. And it's not just occlusion, it's dental well-being. And not everybody can do that. Not everybody should do it.
Anybody that's looking for to be able to help people on a completely different level and do something different in their practice and is tired of maybe the same old grind, excuse the pun, I think that this would be something really that they should take a look at. I would highly recommend the program.
The most surprising, I think, is how much opportunity there is and how much we can help people and how many people really suffer.
I look towards the future and think, wow, what we can do for people, there's no better way to practice dentistry than that.
If you want to get in early and get in with the kind of the rising tide, because I think that this is going to become something very, very significant in our healthcare system.
And if you have a heart for people, you want to institute this into your practice, because this is a way of helping more people than you've ever helped before. And I would say to any dentist who wants to practice good dentistry, good medicine, good care, they should implement this as quickly as possible.
So this is a way to implement something that's really important in these people's lives, and it's going to really change them, and it will make my dentistry part of it more successful.
I think the most important thing we could do is to really, really change some lives and do some wonderful things for people. So, yeah.
It's a better service for the patient. I mean, that's really what it's about. We're serving the patient in a better way.
Yeah, this course, to me, changed everything. This is the standard of care, or should be.